So thank you for joining us to learn more about our Masters in Health Informatics program. Tonight we have with us Dr. Deshae Redden. Dr. Deshae Redden is the Program Director of the Health Informatics Program and Continuous Improvement Coach at Logan University. Dr. Deshae Redden joined Logan University in November 2015. She earned a bachelor's in Health Information Management from Lindenwood University and her master's in Leadership and Organizational Development from St. Louis University. She also earned her doctorate in education from Maryville University. She has 16 years of experience working in healthcare systems, higher education, and state agencies, serving as leader and change agent, employing best practices to ensure achievement of operational and strategic priorities and initiatives. She is also a certified project manager and continuous improvement professional with consulting expertise in healthcare, supply chain education, information technology, government, and nonprofit organization. Furthermore, Dr. Redden has served as an examiner for state quality improvement programs in Missouri and Texas. Dr. Redden's personal philosophy on leadership is that she believes in inspiring and empowering individuals to use their strengths and unique abilities as a tool to achieve their goals. As an educator, she strives to learn from her students to improve her teaching, understanding, and connection with students in efforts to enhance their learning and experience. Finally, Dr. Redden chairs Logan University's Leadership Council, and she is a member of the Quality Texas Foundation Board of Examiners and the Hope Dream Center Board. Dr. Redden.
All right, thank you, Stephanie, for that introduction. I'm going to go ahead and start with the slide, but before I start with the slide, I want to welcome everyone and tell everyone hello, and I'm glad that you stopped by. So let us get started with the presentation. So see if it'll allow me to share my screen. Okay, can everyone see my screen?
Yes.
Okay, perfect. So basically, our agenda today will be to talk about an overview of the program, an overview of the tracks. We'll talk a little bit about the advisory board. We'll talk about professional associations, and we'll also talk about our student and career services. So just to kind of give an overview of the program, the HI degree prepares students to utilize computer technology in advancement of medicine. Health informatics is a rapidly developing scientific field that focuses on information systems design, data management, health policy, public health issues, and is responsible for the design, development, and utilization of patient and enterprise-wide data systems. So one of the key areas that I'd like to talk to students about is there's a lot of words, a lot of information into health informatics. So a quick way to kind of basically talk about it is it's a blending of, health administration, information technology, and business administration. So if you're trying to think of a quick way to think about health informatics, that's the best way that I like to share with everyone about health informatics. So it really does a good job of blending those three areas. So let's talk about some program highlights. This program is known for high paying career opportunities. As you can see, based off of the little informatic that we have in our career guide, we talk about kind of that average salary where you're looking at $90,000. And that can go, and that is a pretty good range depending on what area you're trying to get into. Analysts may make more or less. And then once you get into VP type careers, the salaries can actually double that. So this is a good range in between. Another thing about our program is it's industry-driven curriculum. We have a great industry-driven curriculum. And I'll talk about that a little bit more about how we ensure that we have an industry-driven curriculum. We also have industry experience faculty. So when recruiting faculty, we're looking for people that have been in the industry. A lot of other programs you'll see where, you have you have faculty that has, have been retired or they're out of the industry. So we like to have a combination of someone that has a lot of experience and then also faculty that are actually working in the field. That is both beneficial to the student, and it's also been beneficial to the faculty member because they get to really talk about the theories that we're learning, the theories and concepts that we're learning in our book and applying it in a real world setting. So they can give you kind of case studies and it keeps the information fresh in the classroom. The fourth area is various degree concentrations, which allows students to have different pathways to take. So originally, before I took over the program, there was only one track. And so one of the things that I wanted to implement was to design different career paths for students. Because as Stephanie talked about that long bio that, that we had, I went from different careers. But all of these different careers were in health informatics. I was in supply chain, I was in data automation, I was consulting, I was in all of these different areas. And so that's a very broad scope of health informatics. So I really didn't want to put students in one different area because there are so many different areas that you can, go in and grow in. And so we wanted to design 3 tracks that will help you get there. And we'll talk a little bit more about that a little bit later. The program is also completely online. I know I get questions about hybrid courses and, is it hybrid? But this program is completely online. It's not a set date where you have to log in. You kind of work on your own pace. You have, several days that you can post on, whether that's in the morning or at night, depending on your schedule. It's very flexible. Also, we have a strong online graduate student success and career service. And we'll definitely talk more about that as well. I think that's one of the unique things about Logan is that in a graduate program, you have all these services. Typically, you see that in undergraduate. I even remember being in my doctorate program, we did not have those services. I would have to pay, to get those services for me. So I think that's a plus and something that's going to be very helpful for our current students and incoming students that are wanting to come into that program. And we'll talk a little bit more about that as well. So here is one of my quotes. We want to meet you where you are and help you get where you want to go. That's really kind of how this program came about. We wanted to, again, talk about these different tracks that will help you. So in order to figure out where you're at and where you want to go, we have a process where myself and the assistant program director will talk to all incoming students coming into the program. We talk to them about why they want to be in the program. We talk to them about their career plans. We talk to them about what they're trying to do, how to best use the degree. And so that helps us figure out what is the best track to help you get there, because everything is going to be unique according to each student's background. So Let's just say if you have a background in IT or a background in accounting or a background in education, there are different pathways that you can take, but it really starts with you on what your goal is and what your career goal is so that we can figure out how you can best navigate and get there. So we want to help you along the way. So, and we'll talk about those different tracks just in just a few seconds about, how it can help you get where you want to go. So our first track is our leadership track. So students who go through the leadership track will build expertise in three major healthcare areas: healthcare administration, healthcare information systems and technology, management, and leadership. In this track, students will examine mediums of health information management, databases, data warehouses, data sets, and will develop skills to design and implement various health informatics and information management policies and procedures, um, and also for improvement. So basically in this leadership track, um, some of the areas or some of the careers that you'll see from this track are healthcare directors, clinical information systems, administrators, project managers, specialists, chief medical information officers. So a lot of those leadership um, type of careers. Now, if you're not a leader, that's fine. This track is also for you because this track is really designed for students who are striving to be in leadership or they're currently in leadership positions. So you may not be more in the techie side of health informatics, and maybe you're leading a team of analysts or leading a team of information technology professionals, so you may be leading that and you may not want to get that deep into the data part, but you're still will be able to articulate and be able to lead those teams and lead change within your organization. So this is kind of that track that will help you get there. The second track is the healthcare data analytics track. This is going to be our most popular track. I'm going to say the majority of our students come into this track. So students in this track, they will learn to interpret data effectively, to effectively communicate results and findings to solve healthcare problems across diverse settings. In this track, students will develop the skills necessary to manage, manipulate, and analyze large-scale clinical and operational databases. So this is where you're going to get really into the data science part of health informatics. Some of the roles that we see typically from this track are going to be consultants, analysts, again, project managers, data architects, programmers, data scientists. So this actual track, you're going to see entry level positions here, as well as high level, executive level positions. It really just depends on where you're trying to go and where you're at in your career plan. We have had, VPs to come through the program and go through this track, as well as people who haven't did anything with data analytics at all, and they wanted a nice starting place. So here is that track that's kind of a catch-all for that. And one of the cool things too about the data analytics track, because it has a lot of the computer science and information technology type courses, if you decide to go into different places, outside of healthcare or something more information technology based, you will have those same skill sets to go there. So it really gives you a lot of opportunities to kind of, dib and dabble in different areas as well. Same thing for the leadership track. You're still going to learn leadership concepts, but we're going to look at it in a healthcare setting. Data analytics we're going to learn about data analytics, and we're going to learn about it in the health setting. So that's pretty much that track. Our last track is our applied informatics track. This track is really designed for students who are, well, actually, let me go over that just a little bit. Students who go through the applied informatics track will manage and analyze data for use in clinical decisions by patients and providers, as well as advancing quality improvement efforts across healthcare systems. So basically in this track is designed for, like I mentioned earlier, students who are currently health professionals who already have that healthcare side and that healthcare background, but are looking to kind of round out the different areas that we talked about earlier about healthcare administration, business, and information technology. So it's going to be more focused on kind of getting those other skill sets that you need to be that complete health informatics professional. So you're going to really look at the different population informatics and things of that nature. So students here, we're looking at nurses, physicians, clinicians, any of those areas. You can definitely see them wanting to take on this track. Some of the careers that you'll see in this track is, nurses, physicians, specialists, consultants, health officers, healthcare managers. Any of those areas are careers that you're going to typically see here. I can't tell you how many times that I have talked to physicians and nurses who are using technology in the hospital. And there's kind of a middleman in between when they're wanting to make changes, they're wanting to do different things into the system. And so a lot of times they'll get, advice or consultants from, information technology, but they don't have that experience of being in a healthcare setting. And so the fact that you can have a health professional that will have that can gain that experience, that IT experience, that business experience, is only going to really add more value to your position. It's going to allow you to go different places, do different things, and be able to make those changes that you would like to make that you couldn't because of you just being a certain health professional. So we talk to them all the time, nurses, and they're like, I want to make this change. I want to make these clinical operations better. So here is that track. This may be a track for you. So earlier in the presentation, I was talking about industry-driven curriculum. So how do we ensure that we have an industry-driven curriculum? So one of the things that we do is we have a advisory board. So the goals of our advisory board are ensuring that Logan's program has an industry-driven curriculum to meet the current and future workforce needs, improving visibility, the student services, looking for employment opportunities, partnerships, and employer stakeholders. So basically, in that advisory board, our advisory board consists of all of those different career professionals that we talked about in each of the tracks. We wanted to have each person represent different areas of health informatics so that we can make sure that we're covering all those different areas. These board members are looking at our curriculum, they're looking at our courses, and they're looking at what are the current needs of health informatics and what is the future needs, and making sure that we address those gaps and making sure that our curriculum is where it needs to be. Basically, at the end of our meetings, we want to make sure, we want them to be able to say all of these, and they're actually potential employees as well. But if a student completes our program, would you hire them? And so that's the question. And so they put their stamp of approval on, yes, this is what we're needing. This is what we're needing right now. And so we keep that going with the different board members, and we do cycle them through. So they do have term limits because we want to make sure we keep it fresh, new people in there as well. So just to kind of give you a makeup of the board, we have information technology professionals such as um, architects, analysts, developers, programmers. We also have healthcare professionals, such as we have a couple of different VPs from major health systems, directors of clinical information systems, pharmaceuticals, nurse practitioners. Um, we also have, from our business side, we have consultants, analysts, government agencies such as FEMA, supply chain as well. FEMA is huge, especially right now, because the board member that we have that is from FEMA, um, they are over the logistics of COVID-19 relief, which that is a huge deal here in our global pandemic. And one of the things that COVID-19 has exposed, it really, we are definitely talking about, and I salute the heroes, our nurses and physicians that are on the front line battling this pandemic, but they're also heroes behind the screen as well. And so when you're looking, you can be that hero behind the screen. You can be that person that is working to collect that data. When you look at all of the data, all the decision making that you're seeing our governments make, or our businesses, our employers, on when we should open up, when should we close, is it safe? That's all health informatics. They're looking at that data and figuring out, can we do this or can we not do this? And so they need that information to figure out the best strategies and the best policies and procedures and strategies to help make us safer and figure out where to push and pull resources. So you're starting to see that. You're going to look at, in our program, telemedicine. If you think about all the information technology that when you go into the hospital, that's all health informatics. So that's going to be key as well. So I just really wanted to touch in on that. The next area is our professional associations. Currently, right now, we have a partnership with HIMSS. We are actually in the process of looking at other partnerships as well. So in addition, so one of the cool things that our program offers, if you are a student of our program, you get a complimentary membership with HIMSS. And so from there, I would definitely say look for your local chapter and get your membership. If you're wanting to know that process, please reach out to your ASC or reach out to Erica, who is our career specialist, and they can help you with that process on getting that membership. One of the nice things about that membership is that you get exclusive access to their learning center, and then you also get networking opportunities. Networking, that is key. You want to network. You want to, rub elbows with different people, especially in your area, because they'll find you. Let them know that you have this unique skill set in health informatics, and reaching out to them. And when they have job openings and whatnot, they can, help you with that. And you can tell them that you're interested in doing these different things. And then, friends as well. So I definitely suggest that you, find your local chapter and get involved in that and take advantage of this free membership that we have based off of this, our partnership. last but not least, we're going to talk about our student and career services. So we have a writing center. So with the writing center, a lot of the students that come into our program, um, not all of them, but we have a lot of them that, have already gotten their bachelor's degree and they've been working, and then they've been working for a while. And so then they come back, um, to go back into their master's program, and we get a little nervous about our writing. I know I do that now, where I'm flipping, looking at my APA book, and I'm like, okay, did I cite that correctly? Did I write that? It's, I'm just a little rusty on some different things. Well, you don't have to worry about that here at Logan, because we have a writing center that is free, to where you can send your paper, send your presentation, send all of those writing assignments to someone that can help coach you through some of your writing um, concerns or challenges. I have used the Writing Center when I was working on my dissertation several years ago, and it was a wonderful group, and I definitely suggest using them as well for everything. So I would say that, you give them a couple of weeks to review your work so that you can have that to submit to your instructor. So then you kind of have two sets of eyes on that. I know that sometimes people say, hey, let a friend review it. When I try to get my husband to review something, it doesn't happen. So, and it may not be accurate. So I suggest you go to the Writing Center. So the next area is the career service. When you're getting into a new program and you're going into, to our HI program, most students are looking to transition, they're looking for a promotion, they're looking for a new career path. And so for that reason, we want to make sure we help the student get there. So not only do we want to educate you, but we also want to educate you on helping you get where you're wanting to go, which goes to that quote that we looked at earlier. So our new career specialist is Erica. She is dedicated to our online students. She can help with things such as your resume, updating your LinkedIn, interviewing. These are all key areas that are going to help you get where you're trying to go. And also, career planning. So these are not some of the resume, LinkedIn, and interviewing is not the only things that they have, but these are kind of the highlights. And so you can talk to her and figure out what your career plans are and how you can get there, and what do you need to do. And then also figuring out what are the resources that we have available at Logan to help you as well. So a lot of the questions that I get is, hey, I'm wanting to apply for a different position, or I saw a position and I'm, wanting to apply for it. Should I wait until, after I've graduated, or, when is the best time? And I tell all the students, once you sign up for the program and you've registered and you've gotten your class, that is the time to apply for these different jobs. Let them know that this is, I'm going to be getting a degree, in the next year or the next 2 years, depending on your pace. And letting them know that I'm going to, earn and gain all these different skill sets. So as you take each class, you need to, and I strongly encourage you to work with your career specialist, to help you articulate the new skill sets that you've learned from each class, and you're building on that. And so that you can, get that promotion, so that you can get into your new job field. And there's some situations to where your skill set is going to be so unique that your boss or your employer may create a position for you, because this is something that they're needing. There is a project at the end of the program. And so this is a good opportunity to, use that to invest into your employer and gain experience in the area. So on that note, I'm going to see if anyone has any questions.
And yeah, you guys feel free to contemplate that for a couple minutes. Obviously, a lot of information, and I know some of that, hopefully is some of you are at least somewhat familiar with some of what Dr. Redden was talking about there. But yeah, obviously a lot of great information. And just to introduce myself, my name is Zach. I work as the admissions manager for our College of Health Science. So all of our online programs, obviously our Health Informatics degree falls underneath that umbrella. And we do have a few other admissions folks in here as well. So we're happy to answer any questions that you have on that front also. So yeah, as Dr. Redden said, please feel free to ask any questions or anything. If nobody has anything right this second, I'm going to jump into the, the boring admission stuff of filling out paperwork and sending documents in and stuff. So if anybody has anything, feel free to ask that now. Otherwise, I can jump in and start talking about admissions.
So since everyone is jumping to ask questions, does anyone want to share what kind of career plans or discuss any tracks that you may be interested in and you may have some questions about those tracks?
Yeah, that's definitely some food for thought for people to, think about questions, concerns that you might have on that front. Dr. Redden, we did just get a question in the chat regarding what a typical class would look like in this program. In terms of, obviously our program being online, we really are proud of how flexible it is to go through our programs at Logan, specifically the master's programs. Can you just talk about what the typical layout of one of the classes of that program might look like?
Yes, so typically each class is it's 15 weeks. There is basically we use a Canvas. That's our learning management system, and we basically have a student discussion boards, which is equivalent to if you were in a face-to-face classroom and you were to have discussion between your classmates and an instructor. So you have that discussion board there, and then you'll have assignments that you'll turn in. There are ways to where, like, especially if you're wanting to engage, because I crave engagement and I crave that contact. So we have several different tools that you can use as far as videos. If you're wanting to do presentations, there's tools and ways to really replicate that same experience. I know when I first, before I got into my online program, my master's program was online, but my bachelor's program was not. I was very nervous about that. I was like, I don't know about this. I need to be able to talk to my teacher. I need to be able to see her or him and, be able to have those conversations. I loved my master's program. I was able to, I wasn't stuck on a certain day, to, come, because when I was face to face, it was a Thursday. I had to come in for 4 hours, every Thursday. And I was rushing, trying to come back from work and dinner and children. And with an online program, you don't have to worry about that. You can plan your schedule around that. There's no set amount of hours that you have to have a day, as long as you make your posts on, within the appropriate days, within that range, you're fine. It could be, 3 o'clock in the morning, or it could be 3 o'clock in the afternoon. As long as it's on that day, you're fine with that. And so also with talking to your instructor, you can talk to them virtually via Zoom. You can talk to them via email. You can have a conversation with them. So you still get that interaction as well. And you can also talk and chat with your classmates. I think that through this pandemic, from all the Zoom parties and all of the different things, the creative things that we had to do to contact people without coming in close contact is the same thing that you're going to do in the online program. So I think everyone's probably had a lot of practice on that. So, if there's any group projects, same thing, you would just do exactly what we're doing now, Zoom and working as if you're across the table, with your classmate or instructor.
Yeah, and I think that's the great thing about Logan and the setup of our classes is we do still try to make you feel or allow you to feel like you're part of the Logan community, even though you may not ever set foot on the campus. If you're ever here and would like to come check out the campus, of course, we would be more than happy to show you around and kind of walk you through what our facilities look like and that sort of stuff. But we do want to make sure that all of our online students are aware that all the resources that are available to an on-campus student, you'll have access to that as well. And as Dr. Redden said, one of the things that we really try to do as much as possible in our online courses is promote that engagement between students and faculty, and also with your other students too. I mean, as Dr. Redden spoke about earlier, networking and getting to know people in this field is going to allow you to, hopefully open some more doors down the road. So that's something that we definitely try to promote in our courses. So, Dr. Redden, we do have another question here specifically related to the healthcare leadership track. Is that going to be solely for students who are already working professionals who are looking to move up, or what exactly, what students might be looking into pursuing that, the healthcare leadership track?
Well, anyone can take any track. So, but when we are talking to students and, really trying to help them navigate and really figure out where they're trying to go, I'm really like that quote that I put up about trying to help you get where you're trying to go, that is really what we're trying to do. And so that's just kind of some of the direction or guidance that we give with the leadership track on, okay, hey, if you're trying to get into in a leadership position or you're striving to, this is a good track for you. However, if you're just interested in taking those classes, you can take that track there as well. So when you get your degree, and I tell students this all the time, when you get your degree, it's going to all say the same thing. The only difference is that there's like an emphasis on what you are getting. So it's really about where you're wanting to go. So if you are, in analytics, and maybe you already know analytics, and you're like, you know what? I want to learn something different, because like I said, health informatics is it's a broad range, and there's so many different areas and concentrations that you can take and go. So we do have students that struggle and they're like, man, I really want to take that class. And we work with you on that. So you do not have to be a leader or striving to be a leadership to be in a leadership class. It could just be you wanting to take those classes, and maybe you don't know yet. Maybe you don't know where you're trying to go or what you're trying to do at the moment. And at the moment, that is what, sticks out for you.
And I do try to tell students too, kind of a comparison of what those different tracks are. It's basically just going to be a specialization. But yeah, as Dr. Redden said, you can kind of jump around to different careers after you graduate from our program. Your degree title, no matter what track you pursue, is going to be a Master of Science in Health Informatics, very similar to, let's say, at the undergraduate level, if you get a bachelor's degree in business administration, but have an emphasis in finance or an emphasis in accounting or something like that. Kind of similar to that same mindset, where you'll primarily, kind of the larger umbrella of what you're studying is business, and you just have more of an emphasis of a specific area in those different concentrations or tracks of the program. Evans, to answer your question about credit hours per trimester, most of our students take between 6 to 9 credit hours. You will need to take at least 6 credit hours, which would be 2 classes if you're wanting to take out financial aid. So that would be, something to kind of keep in mind. If you're looking to pay out of pocket, you can just take one course and kind of go through a little bit slower. But most of our students, as I said, are going to take 2 to 3 classes so that you're still eligible to take out financial aid through the university. And that would actually put you right at about the 2-ish year mark for completion. Again, we're very flexible with scheduling, so you can kind of speed that up or take a little bit longer to get through that if you would like. Kind of up to you on that front, how quickly you would like to move through the program. And then another question we had related to the software that we use in our courses is going to the learning platform that we use is Canvas. I'm not sure if that answers your question, Kyle, or if you were looking for something a little more specific. But if you are, maybe you could clarify a little bit there, and Dr. Redden might be able to answer that. And to end the program, Dr. Redden, we also just had another question related to a capstone or practicum, kind of to wrap up the degree. Could you talk a little bit more about that?
Yes. So the capstone that we have currently right now, it is basically an action research project. So you will, throughout a couple of different classes, you're going to figure out a topic that interests you in health informatics, and you'll research that topic. And you can either, you'll have to write about it either way, but you can write about it, or you can actually do a project and talk about how you plan to, maybe it's, solving a problem or solving an issue with your employer. And maybe it is, you're looking at creating, some type of dashboard to do something. So whatever that topic is, you will have a project attached to that, where you would present at the end on what that project is. But you'll have help along the way. So it's not like you're going to get to that class and then they're like, right. There is a research methods class right before you take your capstone class that goes through the different methods. And so you start to prep and start to write and get all your research together. So when you get into your capstone, it's pretty much you completing that project. So it's really not, you'll touch base with your instructor, here and there, but it's not, like the typical classes where you're doing discussion boards and whatnot, every week. It's pretty much working on your project and working with your instructor to help you complete that project. Okay, so applications in the class. So some of the tools that we use right now is Excel, Tableau, R, and Python. So hopefully that will help. We are looking into, because we are developing, more classes. And so we are looking into possibly looking at some areas such as Microsoft BI. But kind of our goal is to make sure that our students are using a lot of some of the tools and software that people are using currently in healthcare. We didn't want to do a lot of focus on, some of the major tools, because depending on the organization that you're going to get in, they're going to have their own, software, and you're going to get your own training on it. So we don't want to lock you into here's the only tool that you can use for analytics. Out of all the different organizations that I've worked at, we've used Oracle, we've used business objects, we've used several different type of reporting tools, SQL, Microsoft BI. We've used all of these different, tools. So it's really dependent on where you're going to work at and where you're going to be. But we try to stick with some of the basic ones, because that will help get you where you need to, so you can get the practice and learn the concepts, because you really need to learn the concepts before getting into the tool. But a lot of your instructors have used those different tools, and we've had students that will ask questions about, hey, I'm using this one, how can I do that? I know, for an example, we have a student in our data mining class. They're using Excel minor. However, this student uses another tool, and so that instructor help that student use another tool as well, because they had experience in that as well. But a lot of time the instructor likes to look at, what is kind of the a neutral area or basic software that everyone can kind of use. Everyone can get Excel and whatnot, but we do have, other areas such as Tableau, R, and Python.
And before we wrap up here in a few minutes, I do want to make sure that I take just a couple minutes to talk about the admissions process a little bit. And again, feel free to ask more questions over in the chat if you guys think of anything over the next couple minutes here. But so just so you're all aware, we do have 3 start dates a year: September, January, and May. We are still accepting applications for the upcoming May start date. That would be the next one that you're able to apply for at this point. And really, as far as the admissions process is concerned, we do try to keep that as simple and straightforward for you as possible. The only things that we'll need from you is just an application, which you can fill out on our website. So if you just go to logan.edu, there's a button at the bottom of the screen that just says apply now. Really just takes 15, 20 minutes to get through that. It's not too terrible. And then after we have your application on file, we'll just require that you have your official transcript sent in for review as well, so that we can confirm that you meet our admissions criteria. We just need to confirm essentially that you have your bachelor's degree and that you have a 2.5 cumulative GPA. And then from there are a couple other just back-end paperwork and that sort of stuff that we need to take care of as well. So I am going to go ahead and put a referral code in the chat on the side. So if you do apply in the next couple of weeks, we can go ahead and waive that application fee for you. It's going to be ARR. It just stands for Admissions Representative Referral. So if you have not filled out your application yet and are planning to do that in the near future, please feel free to use that code. And we'll go ahead and waive that $50 application fee and kind of help you expedite that process a little bit as well. So the only other thing that I wanted to make sure that I mention on the kind of from the admissions side is while you're going through that process, one of the steps that you'll actually complete before you start classes is you'll have 2 phone appointments with different people on campus. After you're accepted into the program, we will have you actually either Dr. Redden or one of our other faculty members is going to give you a call to talk specifically about the different concentrations, the different tracks that we have in the program to help you figure out which one is going to be the best fit for you, and also just to make sure that the program is kind of in line with what you're looking for. We definitely want to make sure that, obviously a graduate program is a big step, both in terms of finance and also just committing your time to going through that. So we do want to make sure that the program is in line with kind of your career goals and what you're hoping to do down the road, and then it's actually going to be a good fit for that. So so that's one conversation you'll have, and those calls are always fantastic. I think a lot of students do get a lot of their questions answered in that phone call. And then after you have decided that you're interested in moving forward, once our registration opens up, you'll have an advising appointment with an academic success coach, and they do a fantastic job of helping you lay out your schedule, make sure you have kind of everything planned out over your time in the program to ensure that you're graduating in a timely manner, however quickly you're wanting to do that. They'll help walk you through our online orientation process to familiarize you with our system. So yeah, those are apart from working with the admissions department, those are the other few phone calls and contact points that you'll have leading up to the start of classes. And I think that's one thing that Logan does really well in terms of being an online school, is still making those connections and allowing you to just have different people that you're reaching out to make sure all your questions and concerns are answered through every step in the process. So I think that's pretty much all I have from the admission side. Like I said, I'm going to go ahead and put the that referral code in the chat as well. So if you want to go ahead and make a note of that and get your application on file sometime in the next couple of weeks, we can we'll have one of our admissions folks reach out to start working with you through that process as well.
And so, if anyone has any questions later on, because I know it was a lot of information, we do go over that when we are talking to students that are coming into the program, and and we can kind of answer those individualized questions on where you're wanting to go, what your career plan, and how this degree will help you get there. So we can definitely do that and definitely have that, and then also work with the career strategist as well to help with that plan, nail down that plan for you. So
does anybody have any last minute questions, concerns, anything else that we can assist with before we kind of wrap things up for this session? No? All right. Oh, looks like we do have one more question here. Yes, for sending in official transcripts, if your school offers electronic transcripts, that would be great. Those can be sent to admissions@logan.edu. It's just our main office email address. I know some schools do still mail out physical copies of transcripts. That's completely fine as well. But yes, if your schools offer electronic transcripts, they can definitely be sent in that way too. It actually is a little bit quicker and a lot of times more efficient for your other school to send those as well. So. Perfect. I think that is pretty much all that we have for you, unless Dr. Redden, do you have any parting words?
Well, I hope to see you all soon. I hope you come to the program and, feel free to ask me any questions. Zach has my contact information. We have students that have graduated from this program and they still contact me about, what do you think about this position or that position? Or I'm struggling looking for something, and we, work with, my colleagues and advisory board, to help out with our students. So you're in good hands. We're going to take care of you from the beginning to the end. So we look forward to seeing you soon, and hopefully you'll join the Logan family.
All right. Well, thank you, Dr. Redden, and thank you, everybody who was able to jump on and join us tonight. We really appreciate you being here. Hope you guys enjoy the rest of your week, and please let us know if you have any questions.
All right.
Thanks, everybody.